Your throat suddenly feels tight. You swallow, the feeling stays. So you swallow again. And then you take a deep breath to make sure everything still works. And somehow, your throat feels even tighter. Now the frightening thought begins, what if I can't swallow? What if my throat closes? What if I can't breathe? And within seconds, one strange sensation can become a powerful anxiety spiral. And here's the part many people never hear. Anxiety can create very real tightness, pressure, dryness, and lump-like sensations in your throat. The sensation is real. The catastrophe your mind predicts may be very different from what your body is actually doing. In this video, therefore, you will learn why anxiety affects the throat, which understandable reaction often keeps the sensation going, and how to interrupt what I call the throat alarm loop. I'll also guide you through a simple 3-step reset. Let's begin with something your body can experience right now. A first moment of relief. Place both feet on the floor. Feel the support beneath you. Allow your teeth to separate slightly. Let your tongue rest gently behind your lower front teeth. And now breathe in softly through your nose. Keep the breath comfortable, and then allow your exhale to become a little longer. The gentle breath in and a quiet breath out. Again. A comfortable breath in and a softer, longer breath out. Now look around the room. Notice 3 objects. Feel your feet again. And allow your next swallow to happen naturally. You have already begun sending your nervous system a new message. A message like, I can notice the sensation and remain connected with the world around me. We'll return to this exercise. First, let's understand what may be happening. The sensation often has a name. A persistent feeling of pressure, tightness, or a lump in the throat is often called globus sensation. People describe it in many ways. A lump, bend around the throat, pressure in the neck, mucus that never clears, dryness. A constant urge to swallow, a scratching feeling, or the impression that something is stuck. With a typical globus sensation, food and liquids usually continue to pass. Some people even feel better while eating or drinking. The sensation may become strongest between swallows, while swallowing salvia or while paying close attention to the throat. And that distinction matters. Feeling as though swallowing has become difficult and having a physical swallowing disorder are different experiences. Both deserve appropriate attention, yes, and they lead toward different forms of support. A brief medical safety note. Throat tightness can have several causes. These include reflux, allergies, irritation, infections, thyroid conditions, voice strain, and conditions involving the throat or esophagus. Arrange a medical evaluation when the sensation is new, persistent, worsening, or accompanied by symptoms such as food repeatedly becoming stuck, progressive difficulty swallowing, pain while swallowing, persistent hoarseness, a noticeable lump in the neck, unexplained weight loss, coughing up blood, or significant breathing difficulty. Sudden severe breathing problems or swelling involves the lips, tongue, or throat, and they require emergency medical care. Once relevant physical causes have been evaluated, anxiety and nervous system activation may become an important part of the picture, because anxiety can create a remarkably convincing throat alarm. Why anxiety affects the throat? Your throat performs several essential tasks: breathing, swallowing, speaking, and protecting your airway. Your brain, therefore, treats this area as highly important. When your nervous system senses possible danger, your body prepares for action. Your shoulders may rise, your jaw may tighten, your tongue you may press upward, your mouth may become dry. Your breathing may shift into your upper chest, and the muscles around your neck and throat may become more active. During an immediate external danger, your attention would usually focus on what is happening around you. During anxiety, your attention often moves inward. You begin observing your throat, every swallow, every dry spot, every change in pressure, every tiny movement. A small sensation becomes louder, and then your mind tries to explain it. And an anxious mind tends to choose the most threatening explanation. Tightness means blockage. Pressure means my throat is closing. This strange breathing means I'm losing my ability to breathe. And those thoughts increase the alarm. The alarm increases muscle tension, and the increased tension makes the sensation even stronger. This is a throat alarm loop. The throat alarm loop. The loop has 4 parts. First, you notice a sensation. Second, your mind interprets the sensation as a threat. Third, you begin checking, testing, or controlling your throat. Fourth, the additional tension and attention intensifies the sensation. And then the loop begins again. Sensation, threat, checking, more sensation. The good news is that the loop has several places where you can interrupt it. And one of the most powerful places is your response. It's a surprising habit that keeps the alarm active. When your throat feels strange, checking feels completely reasonable. You swallow again and again. You clear your throat, touch your neck, stretch your head backward, take a very large breath. Drink water every few seconds. Test whether food still goes down, or search online for another explanation. Every of these actions is an attempt to create safety, and every check brings even more attention to your throat. Repeated dry swallowing keeps the muscles active. Frequent throat cleaning can irritate sensitive tissues. Large focused breaths may increase tension in your upper chest, neck, and jaw. They may also create the frustrating feeling that you can never get a fully satisfying breath. Touching your throat makes every tiny change easier to detect. And symptom searches often introduce your mind to even more frightening possibilities. Most importantly, repeated checking teaches your brain this area requires constant surveillance. Your brain watches your behavior. When you respond as though a sensation represents immediate danger, your brain becomes more likely to sound the alarm again. And that means your behavior can also teach your brain something new. You can show it. I notice a sensation. I respond with care and I return my attention to life. The 3-step throat reset. When a tightness appears, remember 3 words. Recognize, release, reorient. Recognize, release, reorient. Let's go through them. Step 1, recognize. Describe the experience in calm and accurate language. You might say, my throat feels tense. My nervous system is activated. This feels like a familiar throat alarm. Notice the difference between these statements. My throat is closing and my throat feels tight. The first sentence presents the feared conclusion as a fact. The second describes your current sensation, and that small change creates valuable space. Space between the physical feeling and the frightening story your mind adds to it. You can remind yourself, this is a powerful sensation. I can give my body time to settle. For many people with anxiety-related throat tightness, breathing and swallowing continue to function while the sensation feels intense. Your aim is to recognize the alarm calmly. You can respond without debating every fearful thought. Step 2. Release. Begin with the jaw. Allow your teeth to separate. Let your tongue rest behind your lower front teeth. Soften your shoulders by 5%. Because a small change is enough. And now breathe in gently through your nose. And let the exhale become slightly longer than the inhale. Keep your breathing quiet and comfortable. A soft breathe in and an easy breathe out. You might say silently, soft jaw, resting tongue, easy exhale. Your throat has managed swallowing throughout your life, so give your body room to perform this familiar process. Allow the next swallow to arrive naturally, and then offer your throat a short pause from further testing. Release means cooperation. You create helpful conditions and allow your body to respond in its own rhythm. Step 3. Reorient. Anxiety creates a narrow tunnel of attention. Everything becomes about your throat. Reorienting helps you widen the tunnel again. So look around and name 3 things you can say. Two sounds you can hear. And one place where your body touches the supportive surface. and then direct your attention toward your next meaningful action. Continue the conversation, return to your work, walk into the next room. Listen to the person in front of you. Feel the movement of your feet while walking. Your aim is to expand your life around the sensation. Your throat can be present while your attention reconnects with the wider world. Recognize, release, reorient. That is the 3-step throat reset. Let's practice it together. Notice what you're feeling right now. Perhaps your throat feels relaxed. Perhaps you became more aware of it while listening. And either response is understandable. First, recognize. My attention is on my throat right now. Second, release. Separate your teeth. Rest your tongue here. Allow one soft breathe in and one longer breathe out. Third, reorient. Look toward the farthest point you can see. Notice the color. Listen for a sound. Feel your feet. Then gently return your attention to my voice. You just practiced meeting a body sensation with guidance rather than fear. And that is a skill. And skills become stronger through repetition. Reduce checking gradually. When checking has become a habit, work in small steps. The next time you feel the urge to swallow repeatedly, pause for 5 seconds. During those 5 seconds, soften your jaw and look around the room. And later, extend the pause to 10 seconds, then 20 when you decide. When your hand moves toward your neck, place it next time on your leg instead. When you feel the urge to take huge breaths, choose one gentle exhale. When you want to search for symptoms again, give yourself 5 minutes first. Use that time to walk, listen to music, speak with someone, or continue your current activity. Each small pause teaches your nervous system, I can experience uncertainty and remain present. Progress often begins in tiny moments. One swallow that happens naturally, one breath you allow rather than control. 1 minute in which you return your attention to your life. And these moments add up. Release the demand for immediate relief. That's important because many people think my throat has to relax right now. And that thought creates another task. Now you monitor your throat to see whether it has completed the task successfully. It puts pressure on you. Every moment of tension then feels like evidence that something is wrong. I recommend something gentler. Tell yourself, my throat can settle in its own way. I can continue with my day while my body finds its balance. I'm creating conditions that support safety. This is a shift from force to permission, from control to cooperation, from fighting your body to guiding it. Relief may arrive quickly, it may also develop gradually. And both paths are good. They can lead toward greater safety. Notice when the sensation appears. Throat tightness may appear during a panic, before speaking, during conflict, while eating around other people, at the dentist, in a meeting, or in a moment when you feel watched, pressured, or emotionally overwhelmed. The timing can offer valuable information. So ask yourself, what was happening shortly before this began? Was I feeling rushed? Was I trying hard to stay composed? May I worried about choking, speaking, or losing control? Had I already begun observing my breathing or swallowing? These questions move you from fear toward curiosity. Fear narrows your view. Curiosity helps you identify patterns, and patterns create choices. Can emotions affect the throat? The throat is closely connected with speaking and expression. Some people notice more tension when they hold back anger, sadness, fear, or an important need. And this gives us one possible piece of the picture. Physical irritation may play a role. Muscle tension may play a role. Focused attention may play a role. Emotional pressure may play a role. Often, several factors interact. Therefore, a helpful question is, what does this moment require from me? Perhaps you need to slow down, take a break, express a boundary, speak more honestly. Allow an emotion to move through you, or give your body a moment of quiet. The answer may point toward a meaningful next step. A sentence of frightening moments. When your throat feels especially tight, say this slowly. This is a strong sensation. My nervous system is sounding an alarm. I can soften my jaw. I can allow one easy exhale. And I can return to the room around me. Your pace matters. Your tone matters. Your behavior matters. Let your voice carry the message, I'm here. I'm paying attention. I can guide myself through this moment. When the pattern keeps returning, recurring throat tightness benefits from a comprehensive approach. Physical causes deserve appropriate medical care. Reflux, allergies, irritation, thyroid issues, or voice strain may require treatment. Speech, language pathologists may help with patterns involving voice use, throat tension, swallowing, or frequent throat clearing. Therapeutic support can be valuable when anxiety, panic, health anxiety, traumatic experiences, or fear of choking have become part of the cycle. The most useful question is often, what keeps my personal throat alarm active? Is it muscle tension? focused attention, repeated checking, a frightening interpretation, a specific situation, or a combination of several factors. Once you understand your pattern, you can respond much more precisely. The deeper truth. A tight throat can feel deeply threatening. Breathing, swallowing, and speaking are connected with survival. Your fear makes sense. And your nervous system can learn that tightness and blockage are different experiences. That discomfort can rise, remain for a while, and settle again. That your throat can feel unusual while your body continues performing its essential functions. You can't stop asking your throat to prove your safety every few seconds. You can soften your response, widen your attention, and give your body time to rediscover its natural rhythm. Recognize, release, reorient. One gentle breath, one natural swallow, one moment at a time. Your throat can become one part of your experience again, rather than the center of your world. If anxiety affects your throat, please tell me in the comments how you experience it. Does it feel like a lump, pressure, dryness, a constant need to swallow, or fear that your throat might close? Your experience may help another person feel understood, and feel free to describe to help anxiety, because here you'll find practical ways to calm your nervous system, understand anxiety, and regain more freedom in your everyday life. I'm Carsten Noack.